coming. ठीक है, तो actually क्या है, the topic is इनका they have two products. They are our sponsors. तो इनका they are sponsoring the dinner. So we have to justify their products. Okay. So they have one product, Telsar, Telsar Edge, Telsar AM. So we will just talk 2 minutes on hypertension. They have got Cetaxa, dapagliflozin and metformin combination. So let's talk. Exactly not their product, but basically. So hypertension. देखो hypertension का क्या प्रॉब्लम है कि इन इंडिया आ जाओ पास में आ जाओ तुम तो मेडिकल स्टूडेंट्स हो ना आ जाओ पास में आ जाओ. See, the dichotomy is the last time also I spoke that that the awareness of hypertension is 77%, treatment is 50%, and only 27% of the people hypertension are controlled. Control means below 140/90. Okay, see the dichotomy. Only 77% people know that they have hypertension. बाकी को तो मालूम नहीं रहता. And only 50% take treatment and only 20%. So the compliance is so low, but the benefit is vast. समझे ना? The benefit is vast. That means if you bring the blood pressure below 140/90, then the cardiac failure, cardiomyopathy failure reduces by 50%. कितना फायदा है? And your CVA and coronary artery disease reduced by at least 35%. So there is so much of benefit and so much of lack of bringing this, to control 140/90. It's not a huge issue. Actually, if we emphasize to the patient, give education, be alert, कि we have to bring, with maybe one drug, two drugs, because all the slides are there. If it is more than 140/90, you have to give combination. If it is more than 160/90 or 100, you have to give 3 drugs. Start with angiotensin receptor blocker, ACE inhibitor, add hydrochlorothiazide, add beta blocker, add the amlodipine. The whole idea, any drug doesn't matter. Drug doesn't matter. It is the blood pressure which matters. Blood pressure 140/90. So we have to bring, and preferably 130/80. If we can do this, we can reduce. Just imagine that reducing cardiac failure 50%, CV by. It's a great advantage, but we are not able to do it. So, and then escalating, like they have Telsar, give Telsar, doesn't control Telsar, hydrochloride, then you add a beta blocker, then you add an amlodipine, and then, centrally acting, all this, So the main message is bring the blood pressure below 140/90. And, theoretically, if you say the incidence is very high, almost 30 to 80%. Below 140, it's 30%, and above the age of 80%, the incidence goes to 80%. So it's a huge, huge problem in India, and in India it is little bigger. So this is about hypertension. Try to get the blood pressure below 140/90. That is the aim. Whatever by hook or crook, okay, you have to do it. So this is the gist of. So they have Telsar AM, Telsar Edge. We can give. Now about diabetes, they have Cetaxa. So it is almost similar. Cetaxa also, that India is diabetic capital of the world. India, we have almost 30% people have diabetes, and almost another 20% pre-diabetes. So it's a huge, huge burden for India. And the same escalating thing. If the A1C, everything depends on the A1C. If the A1C is 7%, you start with one drug. If it is more than 8%, then you start with 2 drugs. If it is more than 9%, start with 3 drugs. And again, like blood pressure below 140/90, for sugar, HbA1c below 7%. Okay, HbA1c below 7%. That's our aim. So every 3 months we do it, and then you escalate it. And suppose it's more than 9, then we have to start insulin early. Insulin, actropid, lenti, or whatever, mixed as early as possible. So this is, we have to bring the glycemia down. But in diabetic management, it's not only glycemia only. Now there are 2 waves. One is glycemia control, second is end organ damage control. Glycemia control and organ damage control. You control the glycemia by insulin, by glycemic sulfonylureas and all. But how do you reduce the end organ damage? अब सवाल पूछ रहा हूँ. How do you reduce the end organ damage in diabetes mellitus? Because that's the another aim. It's not only glycemia. You can do it by empagliflozin and dapagliflozin. So in all the prescriptions of diabetes, you have to give dapagliflozin or empagliflozin. And actually, even without diabetes, it is useful in heart failure. It is useful in obesity, even in obese patients, and very safe. Very safe. In obese people, you give dapagliflozin, 10 milligram OD. In what else? In cardiac failure, you can give. So again, your aim in diabetes mellitus is to bring this HbA1c 7% by any drugs. सुधीर दास साहब आ जाइए. तो अब ठीक है, तो दोनों बात हो गई. ब्लड प्रेशर bring below 140/90, preferably 130 by any escalation of drug. HbA1c below 7%. So diabetes management now to control of glycemia, control of end organ damage, glycemia by insulin, metformin, and end organ damage by dapagliflozin. Dapagliflozin is or empagliflozin is a must in today's diabetes management. And of course, insulin, India biggest problem is tummy. हमारे यहाँ होता क्या? All the problems because of tummy, abdominal. So once we have a tummy, insulin resistance, diabetes, metabolic syndrome, coronary artery disease, everything. So and everybody has a tummy. Even he has a tummy. See, I don't have. I even if I eat 2 days fully, I develop. Negative balance. Negative, but you have to be careful because this is a biggest like if you you people are quite sort of healthy. So if we control this, we can control so many things. Metabolic syndrome, diabetes control करोगे तो coronary artery disease control, CBA, everything you can control. ठीक है ना? And of course, no smoking, no tobacco. So this is about diabetes and about hypertension. These are I am giving the basic. बाकी है तो हजारों. There are so many trials showing beta blocker helping. I know, we all know that beta blocker helps. All this, there are a lot of trials. Okay, so we don't go that. So I finished this part, and I will show you very. Last 3-4 days, we have done very fantastic cases. You can't believe. Even if you do in All Indian Institute of Medicine in Delhi, they will be surprised. Left main bifurcation angioplasty, LED bifurcation angioplasty. And we had such interesting cases, right coronary arising from left sinus, left coronary arising from right sinus, and then we doing PTCA. All 3-4 cases मैं आपको दिखाऊंगा. Then we are doing one more thing in cardiomyopathy. If you do a LBB pacing, left branch pacing, then the pumping improves. It's very it costs around 2 lakh rupees, and it's very safe, no problem. So beyond your digoxin, your ES inhibitor, your diuretic, you can get another 10% rise. It's an alternative to the CRTD, and CRT costs around 6, 7, 8 lakh rupees. So we did one case, so we'll show that. So we'll just show you 2-3 cases, another just 5 minutes, okay? This is the lead, and this is the septum. So what we do, we drill. So it works for 2 things. Firstly, when you stimulate the left bundle, the left ventricular activity increases, so it increases ejection fraction. Secondly, it's a pacing. So in complete heart block, so it's like buy 1 and get 2. You increase your heart rate and you increase the cardiac pumping, and it is much cheaper because it costs around 2 lakh rupees only. If you do CRT, it is 7-8 lakhs. So, but it's still little bit in experiment. Big studies have shown that both are similar. We have just done one case, so we have to have more experience. Now, this very old man, 80-year-old man had he had a stent here, from here to here, almost 10 years back, and came with severe chest pain, and obviously, completely this restenosis, stent is there, and we thought this would be difficult, but it was very easy. We just put another stent in that. Just, See, we put another stent and inflated it. See, inflated it, say around 18 atmosphere. See, patient is fine. He comes walking. So it was not that actually difficult. It was easy. Next patient.
LED आपसे सेम तो
कौन सा LED है?
सेम काम सेम टाइप
से इसी पेशेंट को
नहीं ये दूसरा
अच्छा अच्छा ये this see this is very interesting patient. Now see this is the right sinus and this is the उसका अच्छे से फीस को आप hold. So this is the right coronary and right side. This is the LED. LED is arising from the right sinus. And we were really 10 minutes we spent looking for the LED in the left sinus and we didn't get. So we were surprised, kahan gayi LED, kahan gayi, and then we find the LED here. And this has a block here and it has a block here also. So we did the right side and we will call the patient again and do the left side some other time. Next. It was very yes. See this is very almost 99% cut off this one, and there is a lesion here. So we put sort of two stents here, one here. Not that difficult, but hemodynamically unstable, and you like if it closes, then it may collapse. But it was not that difficult. Hello. Okay. It was not that difficult. Now, okay. Next. ये क्या था? ये क्या? अच्छा. First we did here, and then we put it here. Okay. Next. See, we will stand the stand. See, it was very tight. It was very tight lesion. So we opened the OM and we opened the LCX, and it was acute coronary syndrome, and he did very well. Our last question, last. So we had shown LBB, we have shown okay. Easily. Then we have a very interesting case where right coronary and the left coronary are rising from the same place, and we did the right coronary, and we will do it some other time. And the third is LBB pacing. That's what I want to sort of take your help. See, if you are a patient with cardiomyopathy, say 60, 70-year-old, and you know that more drugs, digoxin, diuretic, ACE inhibitors and beta blockers. You give an optimum dose, still patient is not improving. The next option is either CRT or LBB pacing, left ventricular. CRT is 7-8 lakhs, LBB pacing is 2 lakhs, and it's much easier. So if you have any patient, you can send. It's very easier to do. It's like a BBI pacing, and just drill it inside. And according to the trials, it has very good results. But we have to see ourselves whether ejection fraction should increase by 5 or 10%. So LBB, this you can do. Whoever can afford dilated cardiomyopathy, PKH patient can afford. He says that okay, do something for more. Send the patient. We'll do the LBB pacing. And then of course we are doing left main, and we did. Actually, last couple of days we have done very, very difficult patients. I mean, I am telling you, even if you do it in all Indian Institute of Medicine in Delhi, there will be 20 people shaking here and there. But we did it. But just 2-3 people here, we do all that, So thank you briefly about diabetes, about hypertension. If you have any question, you can just ask and we can interact. Some things. Youngsters are there, MBBS people, and sir, उनको जाना है